Good afternoon, and thank you for joining our weekly COVID-19 briefing. Before we begin today, I want to take a moment to express the Health Department's deepest condolences to those affected by this morning's fire. As always, we're joined by Health Commissioner Dr. Cheryl Bedigal. Today's briefing is for press only, but as usual, we are live streaming on the Health Department's YouTube channel. Members of the public are encouraged to check the Health Department's social media accounts for a link to the briefing. Today's briefing will run until 12:30. As usual, we will present remarks first in English, then in Spanish, and then I'll open it up to questions from the press. We ask that media outlets coordinate internally to ensure that only one representative asks questions, and that we limit questions to 3 or fewer. Please keep your questions focused on the topic of the COVID pandemic and the city's response to it. If you have questions about this morning's fire, please contact the mayor's press office at press@phila.gov. With that out of the way, Dr. Bedigal, please start us off.
Thank you. Excuse me. And before we get started, I just want to add my personal condolences to everyone affected by the fire this morning. It's a terrible loss for our city. So good afternoon and welcome to our briefing. Over the past 2 weeks, COVID-19 cases and hospitalizations in Philadelphia have skyrocketed. In the past 2 weeks, 29,882 Philadelphians have been diagnosed with COVID. As of yesterday, we're seeing an average of 3,108 new cases per day, by far the highest number of the pandemic so far and rising rapidly. And the percentage of tests that are coming back positive has risen to nearly 40%, which means that the actual number of people with COVID is far higher than the number who test positive. Conditions at Philadelphia's hospitals are extremely stretched, and many are delaying surgeries that can be delayed. Staff are impacted as well, with many out because of COVID infections. Most people being hospitalized for COVID are not fully vaccinated, and I'm told by the hospital medical directors that those who are hospitalized and vaccinated are usually not boosted. We continue to strongly encourage every Philadelphian who has not been fully vaccinated and boosted to get their shots as soon as they possibly can. Most Philadelphians have done that. More than 95% of adults have had at least one shot. 77.5% of adults are fully vaccinated. More than 231,000 have had their boosters. 90.9% of those 12 and up have had at least one dose, and 71.8% are fully vaccinated. And 25.6% of 5 to 11-year-olds have had at least one dose of vaccine. The CDC has updated its booster shot guidance and now recommends that everyone aged 12 and up be boosted. They've also changed the interval, recommending boosters 5 months after a second dose of Pfizer, 6 months after Moderna, 2 months after the first J&J dose. Boosters offer the protection that's needed to fight the Omicron variant. With hospitals stretched very thin, I am asking every Philadelphian to get their booster today if they're eligible. Even if you're young and healthy, your city needs you to get your booster to help stop the spread of this virus and to help keep our seniors and our young children out of the hospital. I know you're busy. I know it might make you feel bad for a day or so, but we are getting close to the kind of dire situation we all dread, in which treatable conditions can be fatal because our hospitals simply don't have room or staff to take care of those who need help. Beyond boosters, of course, there is more we can do. Everyone should be wearing a good quality mask when inside with others who they don't live with. That means double masking or wearing an N95 or equivalent. Remember that a high quality mask worn under your chin or under your nose doesn't do anything. So if you're going to commit to keeping an N95 on and sealed tight to your face, or rather if you're not going to commit to wearing an N95 on and sealed tight to your face, please wear a cloth mask over a surgical mask. A simple cloth mask is not enough right now. And if you do feel sick, even a little bit sick, please stay home and away from others. If you're able to get tested, please do so. But we've seen with this huge wave of cases and with the national shortage of test kits that many people are not able to get tested. Each day, Philadelphia's many testing sites in total test between 0.5% and 1% of the city's entire population. Staff shortages limit the ability to ramp up testing beyond that point, and home tests are in very short supply. And with positivity edging toward 50%. If you have cough or cold symptoms, a fever, or other upper respiratory symptoms, odds are very good right now that you have COVID. So if you can't get tested, please assume you are positive. Stay home, drink fluids, rest, and try to avoid giving it to anyone else. This is where CDC's new guidance to isolate for 5 days is helpful. If you're able to do a test after 5 days to make sure you're negative before being around others, please do that. But if you can't test at all, that 5 days from the start of your symptoms marks the period of highest risk to others. Mask carefully after the 5 days pass. Test if you can, but also think about who you will be exposed to. It's reasonable to do normal activities with a good quality mask on if you're feeling better after 5 days. But it's not a good idea to go visit someone in a nursing home or visit an elderly relative or a young infant. To wrap up, if you'd like more information about the pandemic and the city's response, you can visit our website at philly.gov/COVID. If you have questions, please call our COVID call center at 215-685-5488. Now I'll turn it over to Zeli to present these remarks in Spanish.
Buenos días. La doctora le gustaría ofrecer sus condolencias por el terrible incendio hoy que se llevó a la vida de 13 personas aquí en Filadelfia. En las últimas 2 semanas, los casos de COVID-19 y las hospitalizaciones en Filadelfia se han disparado. En las últimas 2 semanas, 29,882 residentes de Filadelfia han sido diagnosticados con COVID. Hasta ayer, estamos viendo un promedio de 3,108 casos nuevos por día, el mayor número de la pandemia hasta ahora y aumentando rápidamente. Y el porcentaje de pruebas que están dando positivo ha aumentado a casi al 40%, lo que significa que el número real de personas con COVID es mucho mayor que el número de personas que dan positivo. Las condiciones en los hospitales de Filadelfia extremadamente estiradas y muchos están retrasando las cirugías que pueden retrasarse. El personal también se ve afectado y muchos están fuera debido a las infecciones de COVID. Las personas que están hospitalizadas por COVID no están completamente vacunadas y los directores médicos del hospital me dicen que los que están hospitalizados y vacunados no están impulsados. Continuamos alentando encarecidamente a todos los habitantes de Filadelfia que no han sido completamente vacunados y aumentados a que reciban sus vacunas lo antes posible. La mayoría de los habitantes de Filadelfia han hecho eso. Más del 95% de los adultos han recibido al menos una inyección y el 77.5% están completamente vacunados. Más de 231,000 personas han tenido sus refuerzos. El 90.9% de las mayores de 12 años han recibido al menos una dosis y el 71.8% están completamente vacunados. Y el 25.6% de los niños de 5 a 11 años han recibido al menos una dosis de vacuna. La CDC ha actualizado su guía de vacunas de refuerzo y ahora recomiendan que todas las personas de 12 años en adelante sean impulsadas. También han cambiado el intervalo, recomendando refuerzos 5 meses después de una semana de segunda dosis de Moderna o Pfizer o 2 meses después de una primera dosis de Johnson & Johnson. Los boosters ofrecen la protección necesaria para combatir la variante Omicron. Con los hospitales muy estirados, les pido a todos los habitantes de Filadelfia que reciban su refuerzo hoy. Incluso si usted es joven y saludable, su ciudad necesita que se reciba su refuerzo para ayudar a detener la propagación de este virus y para ayudar a mantener a nuestros niños ancianos y nuestros niños pequeños fuera del hospital. Sé que estás ocupado. Sé que puede hacerte sentir mal por un día más o menos, pero nos estamos acercando al tipo de situación grave que todos tememos en la que las condiciones tratables pueden ser fatales porque nuestros hospitales simplemente no tienen espacio o personal para atender a aquellos que necesitan ayuda. Más allá de los refuerzos, por supuesto, hay más que podemos hacer. Todos deben usar una máscara de buena calidad cuando estén dentro con otras personas con las que no viven. Eso significa doble enmascaramiento o usar una N95 o equivalente. Recuerde que una máscara de alta calidad que se usa debajo de la barbilla no hace nada, por lo que si no va a comprometerse a mantener un N95 no es puesto y sellado intermitidamente a su cara. Use una máscara de tela sobre una máscara quirúrgica. Una simple máscara de tela no es suficiente en este momento. Y si te sientes enfermo, incluso un poco enfermo, por favor, quédate en casa y lejos de los demás. Si puede hacerse la prueba, hágalo. Pero hemos visto con esta enorme ola de casos y la escasez nacional de kits de prueba que muchas personas no pueden hacerse la prueba. Cada día, los muchos sitios de prueba de Filadelfia en total prueban entre el 0,5% y el 1% de toda la población de Filadelfia. La escasez de personal limita la capacidad de aumentar las pruebas más allá de ese punto y las pruebas en el hogar son muy escasas. Y con una positividad que se acerca al 50%, si siente síntomas de tos o resfriado, fiebre, otros síntomas respiratorios superiores, las probabilidades es muy buena que tiene COVID. Entonces, si no puede hacerse la prueba, asuma que es positivo. Quédese en casa, beba líquidos, descanse y trate de evitar dárselo a nadie más. Aquí es donde la nueva guía de la CDC para aislar durante 5 días es útil. Si puede hacer una prueba después de 5 días para asegurarse de que es negativo antes de estar cerca de otros, hágalo. Pero si no puede hacerse la prueba en absoluto, esos 5 días desde el inicio de los síntomas marcan el periodo más mayor de riesgo para los demás. Cubra cuidadosamente después de que pasen los 5 días, pruebe si puede, pero también piense en a quién estará expuesto. Es razonable hacer actividades normales con una máscara de buena calidad si se siente mejor después de 5 días, pero es una buena idea ir a visitar a alguien en un hogar de ancianos o visitar a un pariente anciano o un bebé pequeño. Para concluir, si desea más información sobre la pandemia y la respuesta de la ciudad, puede visitar a nuestro sitio web phila.gov/COVID. Si tiene preguntas, llame a nuestro centro de llamadas COVID al 215-685-5488. Thank you. Gracias.
Thank you very much, Zelly. We'll now move to the question and answer portion of our program. If you have a question, please use the raise your hand function, and we'll take those questions in the order received. As noted earlier, we will ask that media outlets coordinate internally so only one person from their outlet asks questions, and to keep their questions focused on the COVID pandemic. Dr. Bedigol is not able to answer questions about this morning's fire at this time. If you have questions about the fire, please contact the Mayor's press office at press@phila.gov. First up, we'll go to Johan Calhoun from Chalkbeat. Go ahead, Johan.
Thanks for having me. These questions are for Dr. Bedigol. The first one, a lot of people are wondering, why is the city not advising the school district to go virtual with the numbers that we are seeing now?
So we have talked with our own infectious disease specialists. We have also consulted colleagues at Children's Hospital, and we've looked at the literature. And overall, I think we all agree that children are best served by in-person education. There is no evidence from throughout the pandemic that school closures are beneficial in decreasing transmission. And our own data from Philadelphia, when we do see cases in schools, the majority of those cases are not coming from in-school transmission. They're coming from the home setting, from activities outside of school. So, I think the piece of this that I feel like gets lost sometimes is the fact that kids, if we close schools, in addition to the effects on learning, which I think we're all very aware of, kids do lots of other things, right? And they tend to mingle with other kids outside of school. So we still see a lot of transmission in that case, in addition to the negative effects on learning. So that's the reason that we are very strongly supportive of the school district's efforts to keep school open, with the understanding that, with the number of cases in Philadelphia, with the staffing shortages, they're doing their best, but many schools are still switching over to online. I will add that we have made a recommendation that if feasible, they offer an online option to high-risk kids and to their families, to families who have a high-risk member.
Okay, should the testing at the schools be revamped? Because right now the district is testing symptomatic students as compared to not testing asymptomatic students.
So there continues to be a severe national shortage of test kits. So, even the testing that's currently happening, I think may be a challenge with the number of test kits available. It's a national problem. I think ideally, if you had enough resources doing assurance testing for every child or offering that would be great, but the tests simply don't currently exist.
Mm-hmm. Early last month, you were concerned about the vaccination numbers for youth. At that time, only 9% of Philadelphia youth ages 5 to 11 had received the COVID vaccine. How are those numbers looking now?
So it's a little over a quarter, about 25.6% as of yesterday. So rising pretty rapidly. We do anticipate that the vaccine mandate, which goes down to age 5 and 3 months, will likely be a big help there as well. And vaccines continue to be readily available all over the city.
And if I can ask one more question, has the department updated its guidance to schools based on the new CDC guidance released a week ago? Because it seems the guidance and protocols for Philly schools that I've seen were from November or pre-Omicron. And you can correct me if I'm wrong with that.
So we updated them yesterday, and at that point, the CDC had not clarified whether the 5-day guidance applied to school settings. So we were assuming that it did not. They then clarified that last night to say that it does. We are discussing internally, discussing with colleagues at CHOP about, given the shortage of testing, the high number of cases, but also the benefits of in-person education, should we recommend a switch to the 5 days? We have not yet done that. My guess is that those conversations will take another few days.
And you're recommending
I'm sorry, Johan. We have a lot of people asking questions. You're now on your 5th question. So we're going to move to Lauren Make from Channel 10. If we come to a second round, Johan, I'll have you on the list. Lauren Make, Channel 10, you are open.
Thank you. Dr. Bedigal, on testing, it was a week ago that the White House said that they would be putting a federal testing site in Philadelphia, and we haven't heard any details from them since then. Have federal officials been in touch with you, and is that testing site happening?
Yes. So I'm really cautious about making announcements until I've actually seen solid evidence that the thing is happening. But my belief is that we will have a soft launch tomorrow of a new testing site in Southwest Philly that will be run through FEMA and state and federal resources, and then we'll be up 7 to 5 starting on Friday. So we'll release that information. Jim can send it out. I want to see it.
How many tests will they be able to do a day?
My understanding is at least 500 tests a day. Okay.
And do you have a location yet? A specific location?
The plan is for Sabati Rec Center, which is in 19153.
Okay. And then on hospitalizations, you mentioned that there are some hospitals that are delaying surgeries. How many are doing that? And given the levels of hospitalizations we're seeing now, what is the limit where you say that the city needs to step in and either do an overflow site or put in some other restrictions to get the numbers down?
So we are doing things gradually in collaboration with the hospitals. Currently, there are more than 1,000 people in Philadelphia hospitals with COVID. I think questions about their decisions on elective procedures should go to the hospitals. And, as you know, we have put in a variety of different measures that I think many people see as very restrictive, including the vaccine mandate that started on Monday in an effort to control cases. The mask mandate continues. We continue to try to stay away from closures and capacity limits. I can never say never, but we're working closely with our hospital partners.
Okay. And just to wrap up, my colleague Rosemary Connors had a question. I'll ask it for her, so we're coordinating. It's on the AstraZeneca drug, Evusheld, and I apologize if I'm mispronouncing that, but the FDA has authorized it. How promising is this, and where does supply of this stand in Philadelphia?
So, the new drugs that are FDA approved are very, very short supply. Far, far fewer doses than are needed. Hoping that all of that ramps up over the course of the next few weeks, but we don't yet have a large enough supply for this to be a real solution for the city.
Thank you very much. Thank you, Dr. Bedigal.
Thank you, Lauren. Next up, we're going to go to Laura Mcchrystal from the Inquirer. Go ahead, Laura.
Hi, Dr. Bedigal, I know you mentioned the federal testing site will perhaps open tomorrow, but can you expand at all on, are there any other efforts to ramp up testing, or are we really at capacity right now?
So the other thing that we've been working on is a large order of home tests. We don't yet have it. We have promising progress on it, but just trying to get more home tests available, both to sites in neighborhoods and then for people to be able to have access to. It still won't be enough, but we had put in a big request for federal access to tests. That was rejected, although they are distributing some tests through community sites. I don't believe those have arrived yet. But the addition of the federal site is the big addition to testing.
Okay, and speaking of home tests, for people who can get them, and test positive, that doesn't get reported back to the city. Are there any efforts to kind of get people to self-report that? Or I guess more broadly, are you worried that we just have a huge undercount of cases right now?
I'm pretty sure that we have a huge undercount of cases. A piece of that is the home tests, and a piece of that is just the large number of people who are not getting tested right now for a whole variety of reasons. So when we're seeing a positivity rate of close to 40%, we know we have a massive undercount. Increasingly, as we move deeper into the pandemic, as more people are vaccinated, also, we're going to be going by hospitalizations more than we'll be going by case counts. So the case counts still matter to us. And, although I know there's a lot of missing data, knowing that we have 3,000 cases per day is still valuable information about just how prevalent this is in the city. But I'd rather that people have access to tests at home than have really solid case data. I think it's much more important.
Okay. And lastly, how is the vaccine mandate going, for restaurants and other venues? And could you also speak to, given the, transmissibility of Omicron, even if people are vaccinated and they could be unboosted too, like having them packed in a bar, is that, to what extent is the mandate helping even? So far, from what I'm hearing, the mandate is going well. That does not mean that any given restaurant is perfect. So we are, our inspectors are going out, they're doing education, they're responding to complaints, and they're also going out in the course of their usual restaurant inspections. The education piece is going to be key. This is a big new initiative. The place where I'm hearing the most success is from colleagues in medicine who are having people come in wanting to vaccinate their kids, themselves, because of the mandate. And I'm getting a good number of those emails now, which is really encouraging. In terms of going to a packed bar right now, I really think people want to think carefully. It's one thing to go to, a restaurant with good ventilation, nice spaces between the tables for a meal with a small number of people, and something quite different to go to a packed bar.
So, I'm hoping that people are going to make good choices right now, that people are cognizant that even if they're vaccinated and boosted, they could potentially get COVID if they're in a space with enough people and bring it home to somebody else.
Okay, thank you.
Thank you very much, Laura. Next up, we're going to go to Ayanna Jones from Philly Tribune. Go ahead, Ayanna.
Hi, yes, good morning. There's been a lot of reports coming out around a big uptick in terms of children being hospitalized with COVID. Can you speak to what's happening locally around that?
Yeah, there is a large increase in the number of children in hospitals with COVID. That's definitely true here. It's true across the country. As far as we understand it, it is not that Omicron is more severe in children. It's simply that the sheer number of cases, even with a very small rate of hospitalizations, will result in more kids in the hospital. This is the reason that all of us need to get vaccinated and boosted. We need to protect kids. We need to remember that this is not over. And when I look around the city, I think a lot of people have kind of forgotten that. But there are a lot of people still at risk, and we do need to protect our kids. Hospitals, children's hospitals in general are very full right now, not just with COVID, but with all sorts of upper respiratory viruses that circulate in the winter, most of which can be prevented by the same kinds of measures.
Okay, and to piggyback on that, on the importance of people getting vaccinated, are there any specific measures or efforts that the city is undertaking to vaccinate children at this time?
Yeah, we have been continuing to push our own vaccination clinics. We are working with partners. We're also talking with federal agencies about bringing in a federal partner to work with one of our strong community partners to set up additional vaccination clinics with evening and weekend hours to make things easier for families.
Okay, all right. Thank you.
Thank you very much, Ayanna. Next up, we're going to go to Mike D'Onofrio from Axios Philly. Go ahead, Mike.
Where am I? Unmuted? Okay.
Yep.
Yeah, I just have one quick question. If you could just tell me, how difficult is it to find an at-home testing kit at the moment in Philadelphia?
It's very difficult to get an at-home testing kit in Philadelphia. I think you can order them online if you're willing to wait a few weeks for them to arrive. But just getting one from a pharmacy or another kind of store, I think they fly off the shelves very, very quickly.
I just wanted to ask, are you seeing any issues of people selling them on like a secondary market, say Facebook or Craigslist or anything like that?
I haven't seen or heard of them on social media. I've definitely heard tell of people selling them on the street.
Cool. That's all I got. Thanks.
Thanks so much, Mike. Next up, we're going to go to Dave Melander from Philly Sportsbook. Go ahead, David.
Dr. Bedigal, I got a couple questions for you. One, have there been any complaints about the vaccine mandate with the Wells Fargo Center since this went into effect a couple days ago?
Oddly, no.
Okay. Secondly, have there been any, with the rise in the cases going on right now, are there any discussions about lowering like crowd attendance for games like the Wells Fargo Center and other entertainment venues?
Again, I'll never say never. We aren't currently talking about capacity limits or closures. I do think people want to be very, very careful, especially either if they are not fully vaccinated and boosted or if they have somebody vulnerable at home.
And my last one, in New York, all professional athletes have to be vaccinated in order to play in New York. Is that mandate go for Philadelphia as well?
So in Philadelphia, there's a protocol for athletes and performers that includes same-day testing for those who aren't fully vaccinated. So it's a little bit more flexible, but still there are rules for the athletes.
All right, thank you.
Thank you very much, David. And we've got 1 minute left, and I know that Johan Calhoun had a question for us. I'm going to go to him. Johan, ask a question. Go ahead.
Yes, Dr. Bedigal. You mentioned the KN95 mask. Those are specific masks to find in the city and very hard to come by in areas across the city. Where can students go and purchase those masks? And these are students who are going to school.
Yeah, so it could be an N95 or it could be a KN95 or again, double masking. they're sold often in drugstores, pharmacies. They're also often sold, or an equivalent filtration, often sold in places like Home Depot, Lowe's, places that do construction, because the filtration is important in construction work. So, and of course, you can also purchase them online.
Okay, thank you. And apologies for the extra questions earlier.
Not at all. Thank you very much, Johan, for that important question. Seeing as we are out of time, we're going to end today's briefing. For the foreseeable future, folks, this briefing will be held weekly on Wednesday mornings. Details on next week's briefing will be issued via Media Advisory. Thank you so much for joining us this morning.